we're going to look at how to cut and crush pills. Now, usually we'll cut pills because the order calls for a half tab or a half dose, but it could also be because the patient just wants them to be a little bit smaller. We'll crush pills either to put them in applesauce or something to make it easier for the patient to swallow, or because we have to give them via NG tube. Either way, make sure that the medication you're giving can actually be cut or crushed before you do it. So let's say our provider order calls for a half tab of this medication. You're going to open the pill cutter and remove the pill from its packaging. Then you want to carefully place the pill in the cutter and turn the pill so that the scoring line lines up with the blade. Just be careful, don't cut your finger. Once you have it lined up, you can close the cutter firmly and you'll feel that pill snap. Once you've cut it, you can open the cutter and drop half of that tab into a medicine cup. The other half you can dispose of appropriately based on your facility's policy. Just make sure that you close the cutter again so that no one cuts themselves. Now, if we need to crush pills, we're going to use the crushing chamber. Now, anytime you're crushing pills, you're going to do this one medication at a time. Don't ever mix multiple meds in the crusher. So open the pill crusher, remove the pill from its packaging, and put the pill in the crushing chamber. And then you're going to twist it closed. And you'll have to twist past resistance. That's okay. That's just the pill breaking. And then just twist it back and forth a few times to make sure that the pill's fully crushed and you've got a nice fine powder. Open the crusher, tap the lid a few times to kind of remove residue, and then you can transfer the powder into a medicine cup. Now, you're going to repeat this process with each medication that you need to administer, each of them being in their own medicine cup and separate from the others. Again, push past resistance, twist back and forth a few times. Sometimes you might have to open and kind of readjust the powder and twist it again. Just make sure you've got a nice fine powder with no chunks. Now, if you're giving this in applesauce, do it a little bit at a time on the spoon, one medication at a time. If you put it all in the full applesauce cup and the patient doesn't want to eat it all, then you don't really know what they've gotten and what they haven't. Now, if you're giving it via NG tube, you're going to take these individual medicine cups and water with you to the bedside and prep for that. Make sure you check out the NG tube medication administration lesson for more about that. Now, if you're ever unsure whether or not you can crush or cut a pill, check with your pharmacist. That is what they're there for. All right, guys, go out and be your best selves today. And as always, happy nursing.